Depression, a chronic disease, done by Regina Gomez, Janice Kadima, and Ariana Romero. Today's presenters will be Regina, Janice, and Ariana. Depression is when your brain doesn't have enough important chemicals called neurotransmitters. These chemicals help your brain communicate and feel good. When there's not enough of them, it can make you feel less happy or even sad. The name of these neurotransmitters are serotonin, norepinephrine, and/or dopamine. It is very important to manage depression. Untreated depression can lead to suicide and a poor quality of life. If someone doesn't get help for their depression, it can help them feel really bad, and sometimes they might even think about hurting themselves. They may not enjoy things as much, and their life might not be as good as it could be. Getting help is really important so they can feel better and enjoy life. Here are some causes and modifiable risk factors for this disease. Depression can happen for different reasons. Sometimes it's because of things going on in someone's life, like problems with family or friends, or even really stressed out about school. Other times, it can be because of a change in the brain's chemicals that affect how someone feels. It's like when the brain gets a little mixed up and makes someone feel sad or down, even when things are okay. Genetics play a large role in depression. People with a first-degree relative, like parents, siblings, and grandparents, who suffer from depression are twice as likely to develop depression. Hormonal disorders are also linked to depression. Pregnancy can lead to postpartum depression, which could result in long-term depression. Depression is more common in women. Doing drugs and alcohol could increase your chances of developing depression. And being unable to handle hard situations could also increase those chances. Some signs and symptoms of depression. There's anguria, which is a lack of energy, exhaustion, agitation, which means you get irritated very easily, noise intolerance, slow thinking process, weight changes, whether that's up or down, isolating behaviors, and oftentimes patients can be very tearful.
In this slide, we will be discussing treatment and management of depression. Unfortunately, there is no permanent cure for depression. As defined, a cure would mean that there is treatment that gets totally rid of the disease. Depression itself can be passed down from parents, so that's also known as a genetic disease. There are fortunately some management strategies that we can use in dealing with depression, and we like to share those with you, such as talk therapy and counseling, medications, and exercise. In a study that was done, a group called COPE was developed in 2016, and this group suggested that these activities would help when patients are dealing with depression. They suggest a 1-week session for 15 weeks of a health class, along with cognitive behavioral therapy, which is basically just therapy, and then 20 minutes a day of physical activity. In this slide, we will continue with a creation life principle. We chose environment. The studies that we've read show that the environment that you choose to live in and who you surround yourself with, such as what type of neighborhood you live in, whether it is out in the country or rural or in the city, like in Denver, it could make a big difference on how you deal with your depression. A social determinant of health is a new phrase that the government is using when they are putting in some resources for people to deal with depression. And it shows that according to where you live and your surroundings, you could be more predisposed to depression, meaning that you will have depression more than other people. A defining factor of social determinant of health is A factor which decisively affects the nature or outcome of something. So an example would be pure force of will was the main determinant of his success. So that would be like someone that pushes forward, and makes it through college. That would be a good example of that. And you can find information regarding social determinants of health in the Creation Life Principles website. And we also have listed the definition for social determinants of health through Oxford dictionaries.